exercise is a foot elevated hip shift exercise. So the goal here is to have your foot elevated on something. So I have a yoga block. Yoga blocks work well, or even a book or two if you don't have a yoga block. The purpose here is to be feeling some opening in the back of the hip and butt, back of the pelvic floor as well. So basically, you are going to have your back foot elevated. So this yoga block is a little bit high. It may actually be too high. So I'm going to switch it out for a couple books. So you don't want it to be too high because that will kind of throw things off. So I've got a couple books here. My foot is slightly elevated. My other leg is in front. So basically what you're doing is as you shift back, this back leg will straighten a little bit. And then you are going to reach your hand towards that foot that's elevated, as well as rotate your belly towards that leg that's elevated as well. That will help you feel that length in the butt and the back of the hip and pelvic floor. So you'll inhale as you come down. So inhale, and then exhale, come up. And you can hold down there for an inhale as well. So come back down, kind of shift back through that hip crease, as well as reach, hold, feel like you're inhaling down into your butt, exhale, stand. Inhale again. You can have a slight bend in this knee, but it will be mostly straight as you shift back, feeling that length in the glute, and then you can add a reach and a turn of the belly towards that elevated leg, and then you can reach down kind of towards those toes. Hold for another inhale. Exhale. So you can inhale down and exhale up, or you can kind of hold for a little bit longer and breathe down into that butt when you're at the bottom. So hold here, inhale, exhale, and then come up. The whole goal is that we're feeling that lengthening through the back of the hip, butt, back of the pelvic floor as well. So use that as a way to kind of open up the hips and pelvis. Great both during pregnancy to prepare for birth, as well as postpartum too, especially when it comes to low back, SI joint, hip pain. It can be really helpful to open up the back of the glutes and the back of the pelvic floor.